Have you ever wondered if a private habit you've carried for years could be silently shaping your health, for better or worse, and what the science really says about its impact as you age? This video provides educational information on men's health and wellness for men over 40, focusing on the physiological and psychological effects of self-stimulation. It is not a substitute for professional medical advice. Always consult your doctor for personalized health guidance. I'm Dr. Tracy Vuong, a medical professional with 8 years of experience in men's health, hormone balance, and wellness, based in Australia. Welcome to the Dr. Tracy Vuong channel, where we share evidence-based insights to empower Australian men to lead healthier, more vibrant lives. For many men over 40, concerns about energy, physical function, and confidence start to surface, often kept private due to cultural norms in Australia that value stoicism and self-reliance. One topic rarely discussed openly, even among mates, is self-stimulation, a personal practice many men continue throughout their lives but question as they age, wondering if it supports or harms their health. My clinical experience in private practice and community health settings shows that understanding this practice through a scientific lens can dispel myths and provide clarity, helping men make informed choices for their well-being. Today, we'll explore 10 scientifically supported benefits of self-stimulation for men's health, followed by 10 potential risks to ensure a balanced, informed approach. This isn't about judgment or taboo, but about breaking the silence with honest, evidence-based information to enhance your vitality. The first benefit is improved tissue health. Each time an erection occurs during self-stimulation, it acts like a vascular workout, increasing blood flow to the penile tissues, known as the corpora cavernosa. This oxygenated blood flow, as noted in studies in the Journal of Sexual Medicine, helps maintain tissue elasticity and health, supporting erectile function as men age. A patient in his late 60s, a retired tradie from Sydney, reported improved physical comfort after maintaining a moderate frequency of this practice, under his doctor's guidance, enhancing his confidence in daily activities. The second benefit is prostate health support. Research from Harvard University, published in European Urology, found that regular ejaculation, through self-stimulation or partnered activity, correlates with a reduced risk of prostate cancer. The theory suggests that this process clears fluids and potential irritants from the prostate's ducts, acting like preventive maintenance. In Australia, where prostate cancer affects 1 in 6 men by age 85, according to Prostate Cancer Foundation Australia, this natural practice can be a proactive step. However, consult your doctor for regular prostate screenings, especially if you're over 45 or have a family history, as self-stimulation complements but doesn't replace medical vigilance. The third benefit is strengthening the pelvic floor muscles. The rhythmic contractions during climax engage these muscles, which support bladder control, erectile function, and physical stability. A strong pelvic floor, as supported by studies in urology, reduces issues like post-micturition dribble, small urine leaks after urination, common in men over 40. A patient in his mid-60s, a former farmer from Queensland, incorporated this practice moderately and reported better bladder control after 2 months under medical supervision, improving his quality of life. The fourth benefit is stress reduction. Self-stimulation triggers a release of endorphins and a reduction in cortisol, the stress hormone, as shown in psychoneuroendocrinology. This natural stress relief helps regulate blood pressure and eases anxiety, a significant concern for Australian men balancing work, family, or retirement pressures. A patient in his early 70s, a retired teacher from Melbourne, found that moderate self-stimulation helped him feel calmer during stressful periods, complementing his doctor's advice on lifestyle changes. The fifth benefit is enhanced mental well-being. The release of dopamine and oxytocin during climax, as documented in neuroscience letters, promotes relaxation, motivation, and emotional connection. This chemical boost is invaluable for men over 40, who may face mood challenges due to life transitions. A patient in his late 60s, a former office worker from Perth, reported improved mood and sleep quality after incorporating this practice, under medical guidance, enhancing his engagement with family and community. The sixth benefit is improved body awareness. Regular self-stimulation allows men to monitor their bodies closely, detecting changes like testicular lumps or tissue irregularities early. This self-monitoring, as emphasized in the Journal of Men's Health, can be a critical tool for early detection of conditions like testicular cancer, which affects younger and older men alike in Australia. A patient in his mid-60s, a retired salesman from Adelaide, identified a minor abnormality during self-stimulation and sought medical advice promptly, leading to early intervention. Always consult your doctor if you notice unusual changes, as early detection saves lives. The seventh benefit is better sleep quality. The release of prolactin and oxytocin post-climax, as noted in sleep medicine reviews, induces a natural state of relaxation and drowsiness, promoting deeper sleep. For men over 40, sleep disruptions are common due to stress or hormonal changes. A patient in his late 60s, a former mechanic from Brisbane, found that moderate self-stimulation improved his ability to fall asleep and stay asleep under medical supervision, enhancing his energy for daily tasks like community volunteering. The eighth benefit is improved physical control. Self-stimulation provides a private space to practice techniques like the stop-start method, which enhances control over ejaculatory reflexes, as supported by the Journal of Sexual Research. This can boost confidence in intimate settings, addressing concerns about timing that many men over 40 experience. A patient in his early 70s, a retired public servant from Canberra, reported greater confidence after practicing these techniques, under his doctor's guidance, improving his quality of life. The ninth benefit is maintaining neural pathways for desire. Self-stimulation keeps the brain's reward and arousal circuits active, as shown in brain research. This is crucial for men over 40, who may worry about declining desire with age. Regular engagement in this practice, even without a partner, keeps these pathways agile, supporting mental and physical vitality. A patient in his late 60s, a former driver from Darwin, found that moderate self-stimulation helped maintain his sense of vitality, complementing his doctor's advice on staying active. The 10th benefit is fostering a positive body image. As men age, physical changes like weight gain or muscle loss can erode confidence. Self-stimulation encourages acceptance and familiarity with one's body, as noted in body image, boosting self-esteem. A patient in his mid-60s, a retired teacher from Hobart, reported feeling more comfortable with his body after incorporating this practice under medical supervision, enhancing his social confidence. These benefits highlight how self-stimulation, when practiced moderately, can support physical and mental health. In Australia, where men often avoid discussing personal health due to cultural stoicism, this practice offers a discreet way to prioritize wellness. However, it's not a cure-all. Regular medical checkups, especially for prostate health, are essential. Men over 45 should discuss prostate-specific antigen, PSA, testing with their doctor, as recommended by the Royal Australian College of General Practitioners, to catch issues early. Now, let's address the potential risks to ensure a balanced approach. The first risk is overfrequency. Excessive self-stimulation, as noted in the Journal of Sexual Medicine, can lead to physical fatigue or irritation of penile tissues, causing discomfort. A patient in his late 60s, a former tradie from Sydney, experienced mild soreness from overfrequency, but adjusted to a moderate routine under medical guidance, resolving the issue. Limit frequency to a few times weekly, and consult your doctor if discomfort persists. The second risk is psychological dependence. Over-reliance on self-stimulation for stress relief or emotional regulation, as discussed in Psychology of Men and Masculinities, can reduce engagement in other coping strategies, like exercise or social connection. A patient in his mid-60s, a former office worker from Perth, noticed reduced social interaction, but balanced his routine with hobbies, as advised by his doctor, improving his well-being. The third risk is impact on relationships. Excessive self-stimulation may reduce emotional or physical intimacy with a partner, as noted in couple and family psychology. Open communication and moderation are key. A patient in his early 70s, a retired farmer from Queensland, discussed this with his partner and doctor, finding a balance that supported their relationship. The fourth risk is physical strain. Vigorous or improper techniques can cause minor injuries, like skin irritation or bruising, as reported in urology. Use gentle methods and consult your doctor if you experience persistent pain. A patient in his late 60s, a former driver from Adelaide, adjusted his approach after medical advice, preventing discomfort. The fifth risk is hormonal imbalance. Excessive frequency may temporarily disrupt testosterone or cortisol levels, as suggested in endocrinology. Moderation prevents this. A patient in his mid-60s, a retired teacher from Melbourne, maintained a moderate frequency under medical supervision, avoiding imbalances. The sixth risk is reduced sensitivity. Overstimulation can desensitize penile nerves, as noted in the Journal of Sexual Research, affecting physical responses. A patient in his early 70s, a former public servant from Canberra, adjusted his frequency after noticing this, under medical guidance, restoring sensitivity. The seventh risk is guilt or shame. Cultural stigma in Australia, where open discussions about self-stimulation are rare, can lead to negative emotions, as discussed in Men and Masculinities. Counseling or open dialogue with a doctor can help. A patient in his late 60s, a former salesman from Hobart, addressed this through medical consultation, improving his mental health. The eighth risk is neglecting underlying issues. Self-stimulation shouldn't mask symptoms like erectile dysfunction or low desire, which may indicate medical conditions, as per the Medical Journal of Australia. Consult your doctor if you notice persistent changes. A patient in his mid-60s, a former mechanic from Brisbane, sought help for underlying issues, leading to proper treatment. The ninth risk is interaction with medications. Some medications, like antidepressants, may affect sexual function, and excessive self-stimulation could exacerbate side effects, as noted in pharmacology and therapeutics. Discuss with your doctor to balance your routine. A patient in his late 60s, a former driver from Darwin, adjusted his habits after medical advice, avoiding complications. The 10th risk is unrealistic expectations. Overemphasizing self-stimulation as a health cure, without lifestyle changes like diet or exercise, limits benefits, as per health psychology. A holistic approach is key. A patient in his early 70s, a retired teacher from Melbourne, paired moderate self-stimulation with walking and a balanced diet, under medical supervision, maximizing benefits. Let's tie this together with a sustainable plan for informed self-care. Self-stimulation, when practiced moderately, offers benefits like improved tissue health, prostate protection, stress reduction, and better sleep, aligning with Australian men's desire for practical, discreet health solutions. However, moderation and medical oversight are crucial to avoid risks like overfrequency or psychological dependence. A patient in his late 60s, a retired tradie from Brisbane, adopted a balanced approach, practicing self-stimulation 2 to 3 times weekly, paired with daily walks and a nutrient-rich diet under his doctor's guidance. After 3 months, he reported improved energy, physical comfort, and confidence, enhancing his engagement with family and community. To integrate this practice safely, start with a moderate frequency, 2 to 3 times weekly, and monitor your body's response. Pair with lifestyle changes. A 30-minute daily walk boosts circulation, while a diet rich in vegetables, lean proteins, and whole grains supports overall health. Track metrics like energy, sleep quality, or physical comfort in a journal, and consult your doctor regularly, especially if you're over 45, to discuss PSA testing or other screenings. In Australia, where men often avoid health discussions due to cultural stoicism, this practice offers a private way to prioritize wellness, aligning with values of independence and resilience. These benefits extend beyond the individual. A healthier, more confident, you can strengthen family bonds, whether playing with grandkids or joining mates for a Barbie. A patient in his early 70s, a retired farmer from Queensland, shared that moderate self-stimulation, combined with medical advice, improved his mood and engagement, making family time more fulfilling. Regular doctor checkups ensure underlying conditions, like cardiovascular or hormonal issues, are addressed, maximizing the benefits of this practice. This approach isn't about quick fixes, but building a foundation for lasting vitality. Small, consistent steps, moderate self-stimulation, exercise, and a balanced diet empower you to age with strength and confidence, whether at work, home, or in the community. Imagine waking up with steady energy, moving with ease, and feeling present in every moment. This practice, informed by science and tailored to your needs, is a tool to support that journey. This video is for educational purposes only and does not replace professional medical advice. If you're considering changes to your routine or experiencing health concerns, consult your doctor to ensure they're suitable for you. If you found this information valuable, please like this video to support the Dr. Tracy Vuong channel and share it with a mate or family member who might benefit. Subscribe for more evidence-based tips on men's health. I'd love to hear your thoughts. Leave a comment about your health goals or what vitality means to you. Together, we can build a supportive community for Australian men striving for wellness and strength. Thank you for watching, and here's to your health.